Today we're going to talk about mindfulness training in family therapy. Let's begin with a definition of mindfulness. If life is compared to an hourglass, an overfocus on the upper half of the hourglass or the future, what sand is going to fall, where is it going to fall, when is it going to land, leads to anxiety. Whereas an overfocus on the bottom half of the hourglass, the sand that's already fallen or the past, leads to depression. Mindfulness can be defined as life in the central neck of the hourglass, or a focus on the sensations, thoughts, and feelings of the present moment so that we can approach ourselves and others with non-judgmental acceptance. Over the years, mindfulness has proven to have many mental and physical health benefits, several of which have ramifications on our interactions with others. For example, it is shown to improve relationship satisfaction, to bolster our cognitive flexibility, especially in times of stress, to decrease our emotional reactivity to each other, and most importantly, to increase our empathy, which has led researchers to ask, might it then also maximize the effectiveness of family therapy? A study reported in Developmental Psychology in 2014 examined an extensive group of families in central Pennsylvania with youth ages 10 to 14. The control group received an established Strengthening Families Relationship Training Program, which met once a week for 7 weeks. First, the parents and their adolescents met separately, and then they combined into one session for the second hour. The study group received that exact same training program, which also incorporated mindfulness skills, deep breathing, reflections, meditations, and most importantly, a focus on present moment awareness and non-judgmental acceptance and empathy on the part of the parents toward their children. At the conclusion of the study and at 1-year follow-up, both fathers and their children reported an increase in their interpersonal mindfulness, their shared relationship, the parents' ability to manage their use behavior, and then fathers themselves reported an improvement in their own well-being. By contrast, mothers and their children at both phases of the study reported no significant improvement in any one of the 4 areas. A study published the following year in the Journal of Marital and Family Therapy examined 33 couples expecting their first child. The control group was waitlisted for a future training program in this instance, but the study group received 2 hours a week for 4 weeks of mindfulness training, which included couple activities such as mindful touch, communication, eye contact, breathing exercises, and then each member of the couple individually practiced their own 15-minute daily meditation. The results were that men once again significantly improved in all 3 areas of relationship satisfaction, mindfulness, and negative affect. They also began initiating more contact with their babies and started to identify more strongly as fathers. But once again, women had no significant treatment effects. Which begs the question, why did fathers respond so well? Well, experimenters speculate that these fathers probably felt marginalized from the family before their participation. They may have lacked previous models or resources as parents, been resistant to other training programs, or felt societally discouraged as men from practicing mindfulness. Furthermore, they may have been deprived of other opportunities to associate with fellow fathers. So why didn't the mothers respond better? Again, experimenters speculate they may actually have graded themselves more harshly due to an actual increase in mindful awareness. But more than likely, these mothers already had more daily experiences mindfully engaging as parents. They had already attended parenting programs, and they had broader previous experiences with mindfulness and/or yoga. They also probably had established an extensive support network among fellow mothers. In other words, these mothers didn't show more significant improvement because they were already benefiting from the daily practice of mindfulness. So how do we apply mindfulness with our clients in marriage and family therapy? Dr. Diane Gehart has several suggestions. Listen and see if you can pick out 2 or 3 that apply to you in your practice.
I work a lot with families who are interested in doing mindfulness with their children at home, especially if there's, one of the children is diagnosed with ADHD, and some families just want to bring a little more calm to their lives. So the first thing you want to always think about is, are people motivated? And that's an important piece. And usually with the benefits of mindfulness, especially for children, a lot of people aren't. There's potential to avoid medication for kids with ADHD or depression or anxiety. You want to make sure the plan is really realistic. And one of the things I find very, very useful is you want to link mindfulness to some kind of existing regular activity. And I only ask for Monday through Friday or whenever there's a semi-regular schedule. So, you know, you're going to do it before you go to school or before bedtime or whatever it might be, but some regular time so that it's very clear when to do it. If you can successfully pair the mindfulness with some regular activity for 2 or 3 weeks, it does become a habit. It makes it much easier to maintain. And then you really want to look at potential barriers or distractions. You know, what room is the right place? You know, where are people going to sit? That sort of thing. And actually for all students, before they do their homework, it's a really great time, because actually doing mindfulness before homework, when it comes time to take the test, they can do a little bit of mindfulness and actually recall the information. It's a nice little trick to help the grades stay high. And again, 5 days a week, and you're going to start small, 1 to 5 minutes. And for families, 1 to 2 minutes, especially the younger the kids, the more appropriate, the smaller the time frame is. And so for some families, like literally while the car is warming up, you know, in the garage, or before you go out the door while you're putting your shoes on, or whatever it is, where everyone can take a moment to just take 60 seconds, 2 minutes, maximum 5 minutes for a family to do the mindfulness.
In conclusion, while incorporating mindfulness into our daily practice may require making some changes, it promises not only these mental and physical health benefits, but so many relationship benefits, according to these studies, that it behooves us as therapists and family members to incorporate it as best we can. Merging mindfulness training and family therapy may require what any relationship requires: patience and time. But as with most meaningful things in our lives, the effort will be worth it. Thank you.